All right, the U.S. is closing in on nearly 850,000 confirmed cases of the coronavirus, which has resulted in over 45,000 deaths in just over 6 weeks. The reason for the CDC guidelines that the president has been promoting and the physical distancing that includes was to flatten the curve, making sure that our health care facilities were not overrun. Now, people like to make a comparison to the number of deaths annually from the flu. Now, those deaths, which generally are estimates because they don't know exactly that people died from the flu or influenza, but that's over a much larger time frame. I mean, 6 weeks, 45,000 deaths, that's a lot. Here to talk about the current and future risk associated with the virus is Dr. Congressman Roger Marshall from Kansas, who right now is working with COVID-19 patients. Dr. Marshall, welcome back to Washington Watch.
Tony, it's good to hear your voice almost in person. I got to tell you, I'm about to, it was going crazy staying at home, and it's just good to hear the voice of friends. So thanks for letting me come on your show and share part of our story.
Well, absolutely. And just the context, Dr. Marshall represents the 1st Congressional District. He is a medical doctor, and he is now walking back in the role of a medical doctor working with the COVID-19 patients. So what's it like there in Kansas? What's the situation like?
Well, it is spotty, is what I would say. There's little communities where there's outbreaks, and it's been serious. The worst days are behind us. I would say a lot of the places we're at that plateau phase. Now, I've got counties that have not had 10 cases. I may have a couple of counties, just 2 or 3 as well. So every community is different. And like I said, I think the good news is I think the worst days are behind us.
And that's my daughter is actually a nurse, a trauma nurse, but has been working with, volunteered to work with COVID-19 patients. So she's been dealing with that since the outbreak in Louisiana. And she says as well, they're still happening, but it's slowing down. We've probably reached that plateau point as well. But this is a serious virus, and especially for some high-risk categories, age, underlying health issues. So it's not something to be easily dismissed like the flu.
Oh, you're right, Tony. Yeah, I visited with some of my medical school classmates from Kansas University Medical Center. They still have 30, 40 people in their ICU, and they're scarred for life. I mean, these are doctors that have been around a lot, and I could just tell from the tone of their voice, A, they're tired. They've been working their tails off. The doctors and nurses, so many great people out there. We have the best healthcare system in the world, but it is a very serious virus. You do not want this if you're over the age of 65. If you have any underlying medical problem, type 2 diabetes messes with your immune system, and we have an epidemic of type 2 diabetes in this country, unfortunately. So, no, you do not want this virus.
So, Dr. Marshall, now that you've had hands-on experience with this virus and dealing with the patients, talking to some of your colleagues, I mean, we know the threat is real, but can we balance that threat with moving back out and opening society again?
Tony, we have to. There is a responsible and safe way to start opening certain parts of the country. And it's going to really go down to this concept of a community having community responsibility. Now, we're not going to be able to go back and go to a Chiefs game quite yet here in Kansas yet. But we can start talking about it. And that's really the discussion we had with the medical center and some of the leaders across the state. And I've been talking to doctors and hospitals now for a couple weeks. What does that look like? And what we need is more testing availability and probably more PPEs as well. So I think that there's a safe way to do it. Those discussions need to be happening. And then again, we need a community responsibility, though. I think that people are much bigger risk of going to the grocery store and catching this than they are going to work.
Yeah. And I think I like the community responsibility because the president, I was just talking about this earlier, the president gave responsibility to the governors, gave resources, gave guidance, but then let them craft the best practices for them. Governors need to do the same thing for communities, and communities need to do the same thing for businesses and churches and others. Allow them to develop those best practices.
Exactly. And what I've been challenging the healthcare folks in each community is to reach out to their own businesses around town. There's infectious disease nurses at hospitals, at county health clinics that are some sharp people. We need to get them involved out in the private sector. Be talking to the local schools and to the local businesses. What does that look like going forward? But this will not be solved at the federal level. It's going to be solved at the local community level now.
Yeah, absolutely. And from home to home. And we need to take personal responsibility in how we maintain our own health, how we maintain, proper hygiene, all of that. We all have a part to play. Dr. Roger Marshall, thanks so much for joining us, and appreciate what you're doing for the folks there in Kansas and for the rest of us across America standing up for faith, family, and freedom.
Thank you, Tony. You can live in spirit, you can live in faith. My family's going to live with faith and hope. Thanks for having me on today.
Amen. Absolutely.